Hi everyone, thanks for listening to my presentations. Today I'll be talking about a very important topic, and I know you might be familiar with that already, and that is called smoking cessation, and I've tagged this as smoking cessation, a comprehensive lecture on cigarette. In the course of my interaction with my listeners today, I'll be going through why do we need to stop smoking? Why are we even taking several cigarettes? Do you know the reason? I will let you know in a bit. What are the advantages of smoking cessation? When we start smoking, what are we going to gain from that? And you have to be the star, STAR, in your family, amongst your friends, among your peers. Do you know what that is all about? You will know in a bit. And a doctor will take history before placing you on any medication to help you as per smoking cessation. Do you know what a pack here is? Well, don't worry. Very soon you will know that if you take time to listen to this presentation further. We'll be able to calculate the pack here. I'll give you a series of examples. And do you know we can even do tests before smoking cessation is fully embarked upon? You don't know. There's a test called Fagestrol. We'll go into that in a bit. Then you have heard about nicotine replacement therapy, right? Nicodem, gum, spray, lozenges, and the rest of them. Have you heard about bupropion, varenicline, nortriptyline, clonidine? You've not, or you have. Don't worry, in a bit you have more understanding. Then, before even placing you on all those medications, you can embark on non-pharmacological measures to stop smoking, and we'll go over all of them. Finally, you will come across what we tag as withdrawal symptoms. Withdrawal symptoms, when you stop smoking, you're going to experience some stuff in your system. I will go over all of them. Before we move on, I want you to know this, that smoking is the commonest preventable cause of death worldwide. So, with that in mind, let's go. Why is it necessary to stop smoking? Cigarette smoking has killed thousands of people. And how about that? Someone is saying not road traffic accident, but how about lung cancer? But that is not to say all lung cancers are caused by cigarette smoking. No, that's not what I'm saying. But cigarette smoking will cause a larger percentage of lung cancer. How about heart diseases? Chronic obstructive pulmonary disease, particularly chronic bronchitis, and some other cancers all over the body that smoking can be the factor that is controllable and yet is leading to them. As a matter of fact, smoking is the singular treatable or factor that you can do without that is killing people the most worldwide. Smoking. Hundreds of chemicals and tens of carcinogens are involved when you smoke. The longer you are on it, the longer you smoke, the worse the outcome. Nicotine involved in smoking is very addictive. It is delivered to mesolimbic reward pathways of the brain. Do you know why you take several cigarettes a day? I want answers at your end. Oh, you don't know. Okay. The reason is that the half-life of cigarette is very short, just 60 to 90 minutes. That is why you need a replacement to maintain the nicotine level. Just less than 2 hours. If you pick your cigarette right now, you light it and you smoke, 2 hours after, no, the half-life is down to half. So that is why at 50 degrees Celsius wind chill in wintertime, you see people still going out to smoke. Or somebody has embarked on a trip, driving, and it's going to take about 4 to 6 hours. He or she, if he or she is a smoker, will have to stop about 2 or 3 times. Honestly, ask the smoker, they'll tell you that, because the half-life of cigarette is nicotine is very short, 60 to 90 minutes. Also, we need to stop smoking because smoking is an enzyme inducer. In the liver, smoking will shoot out the enzymes. And when that happens, any medication you take through the mouth or you swallow will go through the liver for metabolism. So when the enzymes are in large number, it's going to destroy the medication and then the effect will be done. Example is contraceptive agent taken per oral. Combined oral contraceptive agents by a young woman trying to prevent pregnancy but is smoking excessively will fail and come down with pregnancy. Then for young men who are trying to have babies, but they've been told that they have low sperm count and you are smoking, you are not ready to have baby of your own. I bet. Because smoking will decrease the sperm count. And this might be an advantage anyway, that smoking suppresses appetite. But I'm not going to celebrate you for having, your body mass index reduced because you're smoking. Why? You're going to have more other problems greater than that body mass index alone. Okay? Smoking suppresses appetite. It decreases the production and quality of breast milk. Why would a breastfeeding mother be smoking at all? But if you do, the quantity and quality will be decreased. And to those who are pregnant, if you can't do away with that cigarette, you're likely going to be faced with intrauterine growth restriction and the accompanying complications. And even if your baby survives and you have a live baby delivered, the baby is at risk of sudden infant death syndrome. I bet. And cigarettes contain some levels of monoamine oxidase inhibitor A and monoamine oxidase inhibitor B. There are lots of advantages of smoking cessation. I'll just mention some of them here that you'll be a good example to children because you'll be able to tell them not to smoke. And of course, they will obey you because they've never seen you smoking, right? You'll be able to save money. Different brands of cigarettes will cost a lot of money depending on the brand. But imagine a pack costing $20 per day and you are taking 2 packs, making it about $40 per day. You know how much that would be in a year, right? Your health expectedly should improve, okay? And you should be able to reward yourself after the first month, the second month, and at the 6th month, but not with smoking, right? Maybe you take your family out, or you take your spouse out, or you go on vacation. Just be happy, okay? Okay, what are the possible interventions? Be the start in your family, SDAR. How about that? It's an acronym. S for set a day, and pick a day that is memorable, like a birthday or the birthday of your mom, birthday of your spouse, birthday of your dad, birthday of your child, and so on. Tell everyone around you, because don't do this in hiding. When you were smoking, everybody knew. So when you're going to quit, let them know, because they could drag you back to it. They could not be the cause of relapse. So tell everyone now, you are going to stop smoking on so day. Take ashtray and lighter off, because if you don't see it, you might not be tempted. If you keep seeing that, you may be tempted. Note this, relapse is possible, okay? Expect that, and don't count yourself to be a failure if you happen to relapse. That's why we are available to help you, right? The first time that you try to plan to quit, I'll give you no medication. What you need to do is gradual reduction in the quantity of the cigarettes. Okay? Like if you have been taking 2 packs a day, then that is 20 pieces, right? Reduce it to 30. You do that for 1 or 2 weeks. Then the next 2 weeks, the following 2 weeks, reduce that to 20. Then another 2 weeks or 1 month, reduce that to 10. Then reduce that to 5. But I can tell you, come back next week. If you're unable to get that reduction down, then we can start talking about possible nicotine replacement therapy and some other medications that could be used. So we're going to take some history. We're not just going to grab just anybody walking along the street, or just everybody that comes to the clinic for medical intervention to start smoking. We're going to ask about history of smoking about everyone. That is the first A. There are 5 A's. For medical students or nursing students, there are 5 A's. The first A is ask about tobacco use, respectively, not judgmental anyway. Advice to quit. Okay, you are not giving order, just advice and give them reasons why it's going to be advantageous. Assess the level of motivation or readiness. We'll go into that later on. I'm not going to waste your time here. Then assist by non-pharmacological approach. You may decide to use pharmacological approach if the non-pharmacological is not getting the good result out. Okay, then arrange for follow-up 4 weeks after the quit date, so as to know the progress, withdrawal symptoms, and any relapse to be able to handle that. Still on history, we can start by saying I'll just go do a quick run because I want to focus more on the interventions later on. So the history, I'll just scan through. You can pause and go through it yourself. This is mostly for nurse practitioners, for doctors, and for medical students, right? Why are you here today? Congratulations for taking this step to think that you need to quit smoking. When do you want to stop? Why are you stopping now? Any failed attempt in the past? How motivated are you to stop? That is on the scale of 1 to 10, with 1 being not that motivated at all and 10 being very, very highly motivated. How long have you been smoking? Later on, we'll get to park here, so I'm not going to waste your time here. Any other habits? Alcohol, street drugs. Do you know why? When you are telling somebody to stop smoking and they are doing others, like still dealing with crack cocaine, marijuana, and alcohol, by the time they indulge in all those, they will remember that something is still missing. Then they pick the cigarette again. How many cigarettes per day or per year? We'll get that in a bit. How about vaping? In fact, check my channel for my presentation regarding vaping. I'm not going to waste your time on that. Have you shared this news with your family members or friends? Do you know why? Because if your spouse is smoking and you want to quit, you better plan with your spouse, okay, and friends. Okay, still on history. We want to know the impact of that cigarette smoking on your health. So we have history about heart diseases, diabetes mellitus, deep vein thrombosis leading to pulmonary embolism, chest pain with angina, hypertension, stroke, lung cancer, chest pain, shortness of breath, weight loss, or cancer generally. So we'll go all over that, okay? Further history. Now I want you to pay attention. Because we are going to administer some medications like bupropion. We'll ask about history of eating disorder. Why? If this patient is having eating disorder, no bupropion. Seizure disorders, if this person is having seizures, no bupropion. History of psychosis, if there is history of psychosis, no varenicline, no bupropion. And as a matter of fact, the history of hepatic dysfunction, hepatic impairment, or liver problem generally, we will not give bupropion. See, part of what we're going to do, like doctors, medical students, we're going to have what's called general inspection of the affected person or presenting person head to toe. Check the blood pressure, body mass index, any history of allergy to nicotine replacement therapy in the past. Because if such person has developed allergy to like nicotine, then it's going to be difficult for me to prescribe nicotine to them. Current medications like antidepressant, antipsychotics, benzodiazepine, concern about being an outcast or being ostracized. Let me talk about that. So many people, the reason why they're not quitting is because their friends, their family members, their spouses are smoking. And because they don't want to become an outcast, they don't want to be out of the vogue or whatever, they will continue to keep the line on, right? So we need to sit down about that and have some level of psychotherapy, because you might be the one that will change them. Now, you were all smoking together before, right? And enjoying stuff. If you stop, they may stop because you have stopped. Can you remember what led you to relapse in the past so that we don't repeat it again? It's been said that it's only a fool that will do the same thing at the same time and expect a different result. Living with a spouse that is smoking is a big deal, and we need to address that. Probably call the spouse and have a joint interaction. What method did you use in the past to quit? Maybe we have to change it now. The reason why you are dealing with the relapse today. Okay, back here. This is how we calculate it. We calculate smoking per year or per year as number of cigarettes divided by 20 times the number of years. And I'll give you 3 examples so that you don't think no, just picking stuff up from a kind of abstract. No. Someone is taking 40 cigarettes per day and has been doing that since age of 12 and today is 52. So it means for the past 40 years, he has been taking 40 cigarettes per day. Then we're going to do the calculation as 40 number of cigarettes divided by 20. That is number of cigarettes in a pack times the number of years. And if you do that, I'm going to get 80 pack year. Another example is somebody taking 60 cigarettes per day for the last 30 years. So 60 divided by 20 will give us 30 packs per day. And for 30 years will give us 90 packs per year. 90 pack year, rather. And lastly, so it might be easy saying 40, 60, 80 cigarettes per day. What about somebody not taking that much? 20 cigarettes per day for 40 years. Okay, if we divide the number of cigarettes by 20, which is the number of cigarettes in the pack, times the 40 years, I'm going to get half times 40, which is going to give us 20 pack year. Though he has been smoking for 40 years. Unlike the first example, who has been smoking for 40 years, the number of cigarettes is lower. So the first person was getting 80 pack year, while the last person is getting 20 pack year. The greater the pack year, the more or the more or the higher the likelihood of health-related issues secondary to smoking. So in this category now, the one in the middle will likely have more problem compared to the first example, and the last example we have the least here. Tests to be done. Some doctors say, no, don't go into that, you don't need to do any tests. Yeah, determine the dependency using progesterone test of nicotine dependency. You want to know how this man or woman is doing when it comes to nicotine dependency, right? Then the questions will be, 1, how early do you have your first cigarette? And how many cigarettes per day? So the earlier you start the first cigarette in a day, and the higher the number of cigarettes you take per day will determine the higher the level of the dependency. So let me explain just in 30 seconds. Someone who wakes up and takes cigarettes the first 1 or 2 hours of the morning, that is A, and B, the other one wakes up and may not take cigarettes in the morning, can take it at the lunchtime, then A is taking more cigarettes per day, like 30 or 40 per day, and B is taking about 20. A is more dependent than B. Nicotine replacement therapy could come in form of patch, 21 milligram, 40 milligram, 15 milligram, 12 milligram, 10, 7, or 5, depending on where you are on the surface of the earth and what your country will permit to be imported into your country. You can have gum that will come in form of 2 milligram, 4 milligram, inhaler like 4 milligram, dosage like 2 milligram or 4 milligram, bupropion 75 milligram twice daily, varenicline that is Chantix if you are in the United States, or Champis if you are in Canada, or some other parts of the world will use Chantix or Champis depending on what your jurisdiction will permit or will allow to be imported into the country. That could be in form of 0.5 milligram to 1 milligram. I'll still talk more about each of these in a bit. Nortriptyline and clonidine. We use all this to help people that are now quitting smoking. Okay, before we go into medication, because I always like to explore the non-pharmacological interventions before prescribing medications. The first thing is non-pharmacological approach. Start low. And progressively advance until you reach the day you want to quit. You have set the date right, then start dropping the number of cigarettes. Decrease the number of cigarettes per day. Increase time interval between cigarettes. If you have been smoking every 2 hours, make it every 3 or 4. Then you continue to increase that and every 5 and 6, right? Don't rush for cigarettes early in the morning anymore. Extend the time of the first cigarette. Like if you're taking it every first 2 hours when you get up from bed, delay it to lunchtime, right? Gradually decreasing till you reach the quit date. And if you are running into any trouble, call me on phone. Someone say, oh my goodness, where am I going to get it in? Okay, drop your phone number. No, I'm just kidding. I'm not going to drop my phone number. Call your doctor. Notice, it is a process, okay? It's a process. It's not what you're going to do cold turkey. No, don't start smoking sudden. It's a process, and it's a gradual process. So there should be no cigarettes at home, no cigarettes at office, no cigarette in your car. Keep the diary of every cigarette you smoked, okay? Avoid triggers and occupy yourself with something else when you are having the cravings. After all, the cravings won't last forever. I'm going to go into that in a bit. When you have reached a level that you're not smoking, you are likely going to be faced with some withdrawal symptoms, right? Craving or having smoking urges. Don't worry, that will disappear in minutes. Yeah, 10 to 20 minutes, the cravings will disappear. So please enjoy that, let's say maximum 30 minutes. Okay, when you have the craving, it's not going to be there forever. 10 to 20 minutes, it will disappear. So enjoy that and occupy yourself with something else. Have an increased weight. Yes, because I said smoking will suppress appetite, right? Because smoking will alter your sugar release and insulin. So when you stop, you become hypoglycemic. And then you need to increase food intake to meet that requirement, particularly sugary stuff. and that is how you build your weight. But you can always shed weight by doing more exercise, having your diet control and everything like that. We can give you a pamphlet on how to get about that. Okay? Insomnia and daytime sleepiness is possible when you are having withdrawal symptoms. Cough and quitter's flu. Quitter's flu will present with fever, malaise, sinusitis, coughing, and body aches. Don't feel sorry for yourself. No, just present your doctor and appropriate assistance will be rendered. Okay? You can have memory impairment or difficulty concentrating because you have just decided to quit smoking. Don't be discouraged. With time, you are going to get out of it. And of course, there's likelihood of increased blood pressure, but it's not going to be forever because smoking will actually damage your life the more if you have hypertension and you are still smoking. Okay? So there are stuff that we could do like exercise, diet control, and some other medication. Just complain to your doctor, they'll be able to help you and treat you symptomatically. Still on withdrawal symptoms, you could be feeling dizzy, anger outburst, mood changing, could have constipation, might need to decrease dosage of certain medications, possibility of sudden pregnancy is likely. Why that? Because if you are a couple and you have been struggling to have pregnancy and you are both smoking, or the husband in particular is smoking, and he has decided to quit, there could be increase in sperm count now in his life. And if that happens, boom, there could be pregnancy. Then, if the pregnant woman will stop smoking, there's likelihood of increased fetal well-being. Remember I said in a pregnant woman that is smoking, there's likelihood of intrauterine growth restriction. In those days, we call it intrauterine growth retardation. So, fetal well-being is likely if a pregnant woman will stop smoking. But there is likelihood of lack of pregnancy also if truly you want to control your pregnancy and you are taking combined oral contraceptives, but you have decided to quit smoking now. Remember I've said earlier that if you are smoking and you are taking combined oral contraceptives, it may fail. You may become pregnant because smoking will induce liver enzymes, right? And destroy your combined oral contraceptives. Now that you have decided to quit and truly you are not smoking, you can have maximum effect of the combined oral contraceptives. Okay? Its effects will now manifest. Remember that you can't combine varenicline, that is Chantix or Champix, with anything else. Some will say, combine it with bupropion. So I just like to be safe and want my patient to be safe, right? Chantix, that is in US, that is varenicline. Champix in Canada, that is varenicline. Don't combine it with anything else. If you want to prescribe bupropion, please no bupropion if this patient is having eating disorders. If this patient is having history of seizures disorders, or there's a hepatic failure, or there is psychosis, no bupropion. No nicotine replacement therapy if there is history of stroke or heart attack called myocardial infarction recently. No nicotine replacement therapy. You can use clonidine, but never use clonidine if you take the blood pressure and this person is at the down end or even frank hypotension. No. Or there's history of postural hypotension in this particular man or woman, no clonidine, please. And if you are stopping any of these medications, taper gradually. particularly clonidine, to prevent rebounding hypotension. No varenicline in neuropsychiatric disorders, and you have to watch out for signs of depression and suicide if your patient is on varenicline. Please. How do we approach this? If this patient is taking less than 10 cigarettes per day before, you can help him or her with non-pharmacological approach only. But if it's greater than 10 cigarettes per day, then you have to use non-pharmacological approach with nicotine replacement therapy or bupropion or varenicline. But even if it's less than 10 cigarettes per day, but finding it difficult to quit, you can administer all this therapy as well. If there's no response, you can combine some of these medications like nicotine patch with bupropion or with clonidine or with nortriptyline, but not with varenicline. Nicotine replacement therapy here, example is nicotine patch, given as 21 milligram in 24 hours for 6 weeks. Then you change to 40 milligram in 24 hours for 2 weeks. Then 7 milligram per 24 hours for another 2 weeks. With or without, somebody is taking a guess, right? Let's see. With or without gum, that is Nicorette gum. For those who are lighter smokers, you can give 2 milligram. For heavy smokers, you can give 4 milligram gum. Maximum is 20 pieces per day, and you give that for 6 months. With or without nicotine spray, 1 to 2 sprays every 30 to 60 minutes. The maximum you could give is 4 sprays per hour or 64 sprays per day. Or, are you taking a guess again? Let's see. Or you give lozenges for 12 weeks. But you can pause and follow this very well. If you are giving lozenges, week 1 to 6, you are going to give 1 lozenge, that is 2 milligrams every 2 hours for week 1 to 6. Weeks 7, 8, and 9, you give 1 lozenge, that's 2 milligrams every 4 hours for week 7, 8, and 9. For week 10, 11, and 12, give 1 lozenge, 12 milligrams every 8 hours. I've not ended. Are you taking a guess of what the next medication could be? Let's see. Okay, the next one, yeah, varenicline. Varenicline, that is Champis or Chantis, 0.5 milligram per oral once daily for the first 3 days. Then 0.5 milligram per oral twice daily for the next 4 days. After then, you leave the individual on 1 milligram per oral twice daily for the next 12 weeks. Remember, you start varenicline for 1 to 2 weeks before the individual will stop smoking. Bupropion, 150 milligram per oral once daily for the first 3 days, then 150 milligram per oral twice daily for the next 10 to 12 weeks. But start 2 weeks before the individual will stop smoking. Clonidine, 0.1 milligram per oral once daily or twice daily. But please, keep an eye on the blood pressure, please and please, and not in anyone who has the history of postural hypotension. And with that, I've come to the end of this comprehensive lecture. If you still have any concern about smoking cessation, kindly leave a message on my channel. Thanks for listening. Kindly share this and remember to subscribe. I appreciate it.